Welcome to this Dermalogica touch therapy training video. Dermalogica's 10-minute massage routines use impactful techniques to deliver very specific skin and well-being benefits to make the service experience a memorable one. This video will take you step by step through the lymphatic clearing touch therapy. This particular technique and routine is specifically designed for breakout-prone skins and uses lymphatic drainage techniques to restore skin balance. By encouraging tissue detoxification and stimulating the lymphatic system, we can promote a clearer, brighter skin. We use a light, rhythmical touch in this technique, which has been proven to reduce skin symptoms associated with stress and induce relaxation as it calms the sympathetic nervous system. It also boosts the parasympathetic nervous system and the immune system, which promotes healing to minimize post-breakout marks. This technique is ideal for clients with oily, congested skins and for those struggling with breakouts, regardless of the cause. It's a really good option for those experiencing hormonal fluctuations and the associated fluid retention and puffiness. Individuals with rosacea or severely inflamed skins, where other massage techniques could prove to be too stimulating or intense on the skin, might also benefit from this lymphatic clearing touch therapy. It is important to be aware that as we're promoting lymphatic flow and potentially boosting the immune system, that this touch therapy, like most massage therapies, is not suitable for clients experiencing an infection, a malignancy, an unidentified swelling, or for those who have thrombosis or thyroid disease. Dermalogica's lymphatic clearing touch therapy uses three main techniques. Stationary circles work with the skin rather than on the skin to move the tissue fluid into the lymph vessels. A pumping technique moves in a circular motion to clear blockages and reduce stagnation or toxin accumulation. And finally, a stroking or fanning pressure, which uses a light technique to direct and encourage the flow of lymph along the superficial vessels to the lymph nodes. Combined, these techniques facilitate detoxification of the tissues and decongest for improved skin clarity. You will note that this touch therapy is best performed at the conclusion of your service, after the dermal layering stage and application of moisturizers. This is because moisturizer application can work against the flow of lymph, and backflow will undo all your beneficial clearing effects. So bear that in mind when you are determining when best to incorporate this into your treatment. When performing Dermalogica's lymphatic clearing touch therapy, there are some considerations to ensure that the technique is carried out accurately and is effective for the client. For therapies using lymphatic drainage, it's essential to become familiar with the anatomical positioning of the lymph nodes in the head and neck. This ensures that the drainage is performed in the correct direction to support the flow of that lymph for a positive cleansing action on the tissues. In this unique touch therapy, we work on the following lymph nodes: the buccal nodes in the cheek, pre-auricular nodes in front of the ear, cervical nodes in the front of the neck, submental nodes under the chin, submandibular nodes on the jawline, occipital nodes at the back of the head, post-auricular nodes behind the ear, supraclavicular nodes near the clavicle, and the axillary nodes near the armpit. We also provide drainage towards the parotid gland, which is diagonal to the tragus. Remember, each of these nodes will be stimulated by three specific techniques. Always work towards or in the direction of those lymph nodes. It is important too to work to the proximal nodes before clearing distal nodes to support effective cleansing of the tissues. This is why we start closest to the heart and clear the vessels that empty into the terminus before gradually working up the face. This ensures we can progressively clear any blockages and the lymph can drain effectively all the way from the most distant point on the face. Let's overview the start and finish point of each movement. Technique 1. Sternum pump. Technique 2. Fanning. Technique 3. Scoop and drain. Technique 4. Ear scissor. Technique 5. Jaw pump and drain. Technique 6. Lip pump and drain. Technique 7. Nasal sinus clear. Technique 8. Nose sweep. Technique 9. Forehead pump and drain. Technique 10. Sweep and drain. Now that you have an overview of the routine, let's review the techniques. Take note of the pressure gauge on the side of the screen to help you interpret the pressure level that you should apply for each technique. It is important to be conscious of the positioning of your body to ensure you avoid discomfort in the upper and lower back as well as the wrists to sustain your life as a working therapist. Begin by making sure you're at the right height to work the client with relaxed, dropped shoulders. Be sure to raise the head of the bed prior to beginning this touch therapy to facilitate the drainage. If desired, you can apply a drop of a dermalogica additive or a botanical mixer to your palms or wrists prior to starting the technique. This will enhance and elevate the sensorial experience. Let's review the techniques. Technique 1. Sternum pump. Place the flat palm of one hand with overlapping fingers from the other at the top of the sternum. Use light stationary circles in a clockwise direction. Move skin over skin with the emphasis of pressure towards the top of the circle, then release. This pumps fluid towards the terminus, the venous arches which enter the heart. Technique 2. Fanning. Start just above the sternum with both hands meeting in the middle over the terminus. Fan very superficially over the chest from sternum out towards the shoulders. Fanning from the thumb side to the little finger works the hands over the top of the chest, finishing at the clavicle. Light stroking in the direction of the axilla and supraclavicular lymph nodes helps to encourage the flow and drainage of the lymph. Technique 3. Scoop and drain. Gently slide scooped hands, little finger side, from behind the ear towards the clavicle. Follow the sternocleidomastoid muscle and sweep over the anterior or superficial cervical lymph nodes. Split the fingers of both hands and stroke over the clavicle towards the shoulders in the direction of the supraclavicular lymph nodes. Use thumbs from the end of the clavicle to finish stroking out towards the axilla under the arms. Technique 4. Ear scissor. Scissor the ear with index and middle fingers. The index finger is positioned over the preauricular lymph nodes. The remaining fingers make contact with the mastoid or postauricular and occipital lymph nodes. Pump and circle back towards the back of the head. Move skin over skin with slightly more pressure on the forward motion. Move fingers down onto the top of the sternocleidomastoid muscle or the soft tissue of the neck. Repeat clockwise circling pump movements 3 times with flat fingers. Move down the neck to the middle of the sternocleidomastoid muscle and repeat the circling, accessing the anterior cervical lymph nodes. Finally, place finger pads in the groove of the clavicle and pump each finger individually, one after the other, towards the supraclavicular lymph nodes. Technique 5. Jaw pump and drain. Place index and middle finger on chin above and below the jawline. Pump along the jaw towards the ears with small stationary circles to stimulate the submental and submandibular lymph nodes. Work along the line of the jaw, and when you have reached the angle of the jaw, drain with 2 fingers to the postauricular lymph nodes. These clearing movements facilitate drainage of the tissues in the lower half of the face to relieve breakouts and promote healing. Technique 6. Lip pump and drain. Place index and middle finger above and below the lips. Repeat pump and circle movements over the width of the mouth and into the nasolabial fold. This affects the buccal lymph nodes. Stop at this point and use 2 fingers to drain out towards the pre-auricular lymph nodes. Technique 7. Nasal sinus clear. This movement is a simple pumping motion to help reduce puffiness that may have come from nasal sinus congestion or toxic overload consistent with rosacea and congested skins. Place index and middle fingers side by side at the base of the nostrils. Lightly press and release along the lower cheekbone. Stop just before the jaw hinge and drain to the front of the ear or the pre-auricular lymph nodes. Repeat along the top of the cheekbone to the corner of the eye, then drain to the pre-auricular lymph nodes at the front of the ear. Work lower and upper cheekbone alternately. Technique 8. Nose sweep. This is a transitional movement to forehead. It is light, relaxing and soothing and calms sensory nerves. With a flat hand, stroke the palm of one hand, followed by middle finger lightly up the nose and over the forehead. Stroke off at the hairline. Repeat with the other hand, starting the movement before the first finger reaches the hairline. Keep the movement flowing by alternating hands. Technique 9. Forehead pump and drain. Turn fingers in and place on the center of the forehead. With finger pads, lightly circle and pump out towards the temples on both sides. Move across the forehead in 3 or 4 places depending on the width of the forehead. Stop at the end of the eyebrows and drain with all of the fingers to the pre-auricular lymph nodes at the front of the ear. Technique 10. Sweep and drain. Cup hands and with the little finger shave along the jawline, encompassing submental, submandibular lymph nodes, and work towards the mastoid process behind the ear. Repeat the neck scoop with little fingers tracing down the sternocleidomastoid muscle and sweeping the anterior cervical lymph nodes. Split the clavicle and drain off towards the shoulders. Lastly, slide the thumb towards the axilla to finish the drain. Place the hands over the top of the shoulders and hold for a count of 3. Release.